Exercise 9 deals with the appendicular skeleton. This is highlighted in the reddish color here. The appendicular skeleton is going to be comprised of the bones that make up the limbs and those attachment points to the axial skeleton. So it's going to be the legs, the arms, the shoulder, and the hip. The pectoral girdle, this is your shoulder joint. This is going to be comprised of the clavicle, the scapula, and its purpose is to attach those arms to the axial skeleton. It provides a lot of attachment sites for the muscles. You have a give and take in terms of flexibility versus stability. So with the pectoral girdle, you have a lot of flexibility, but it's less stable. So to gain one thing, you're going to give up on something else. So this is showing here, you have got the clavicle right along here, and then the scapula. Now in this diagram, it does show the bones with a lot of the various bone markings that are marked. A lot of these, remember, are for bone or for muscle attachments. And you can see here some of the various ligaments that are helping to hold this joint together. Now, once again, it's going to allow for a lot of flexibility, so it's not as stable as, say, compared to your hip joint. The upper of limb, your arm, as we go through the bones, we're going to start in the more proximal position and work distally. Your arm is your humerus. The forearm, the lower arm, has two bones. It has the radius and the ulna. And then in the hand, you've got the wrist is composed of 8 carpal bones. The palm of your hand has 5 metacarpals. And then your fingers has actually 14 phalange bones. So if we start to look at the humerus, excuse me, you've got the head here that's going to help hold the bone in proper positioning for the joint. Remember, when we look at bone markings, tuberosities, tubercles, etc., are often attachment sites for muscles. And then here you've got what's known as the neck of the humerus. Fossa, remember, are indentations, often helping with the proper placement of bones for joints. In terms of learning the bones, in terms of learning some of these specific bone markings, there's no easy way. You just have to learn it by practicing and repetition. Are you able to recognize the markings on the bone to help you put the bone in the proper orientation? Is it the right humerus or the left humerus? You may be going into sonography. You may be in a field where you're going to do x-rays, and you need to be able to take an x-ray, say, of the elbow and be able to make sure that you're getting the proper orientation that you need. Can you recognize the various markings of the bones? If we are looking at the forearm, you have excuse me, the radius and the ulna. Notice how the joint is with the humerus up here. And then once again in the wrist, you have the 8 carpals. Then you're going to have the metacarpals in the palm of the hand, and then the fingers, you have the phalanges. So this is showing in the wrist. As I said, there's 8 different bones. Once again, it's often described as almost like 2 rows of 4. You're just going to have to, once again, just sit and learn the shapes. And usually if you can learn the order of them, pick out one that's easier to determine the shape, and then use that as your reference point. And then kind of like go around the circle, if you will. The metacarpals, there are 5 of them. We just number them. Metacarpal 1, 2, 3, and 4. 1 being the thumb. And then here with the phalanges, you have the proximal phalange, the middle phalange, and then the distal phalange. Now the thumb only has 2 phalanges. It's just going to have a proximal and a distal. But the other 4 fingers will have 3 per finger. And once again, this is where your directional terms come into play. The pelvic girdle, the hip joint, is going to be composed of the sacrum and your coxal bones. Your coxal bones are composed of the ilium, the ischium, and the pubis. So here's the sacrum. Remember, it's the 5 fused vertebrae. And then the coccyx, which is commonly referred to as your hip or your pelvic bones right here. So you've got the ilium, the ischium, and the pubis. Those 3 fused together. There are differences with the pelvic girdle between males and females. Females, the pelvic girdle typically is wider. This allows during pregnancy to be able to carry the developing fetus much easier. It tends to be shallower, it's lighter, it tends to be more rounded in shape. The coccyx at the bottom is not as curved. That allows the pelvic outlet to be larger so that during childbirth it's more easily to allow the fetus to pass through during childbirth. Because of that, yes, it is true that more women, percentage-wise, can break their coccyx or tailbone than men do. And the reason is because if you fall and you end up falling on your backside, what's going to happen? Because for women, the coccyx is more straight, you have a greater chance of landing on that and breaking it. For males, it's more curved, so it's more protected. So this shows some of the differences between the male and female. This arch also right here, this pubic arch is wider in females than over here in males. But notice it's wider distance through here. The opening, which is known as pelvic outlet, is wider. And from the side view, see on a male that coccyx is really curved, but on a female is straight. So if you fall, you have a greater chance as a female of breaking this. Males, you can still break it, but it's a little bit more protected than females. With the lower limb, the thigh, this is the femur. The femur is the longest bone in the human body. You're having to help to transfer the weight down. So it's very large. It can take a lot of pressure, a lot of weight coming straight down, but not from the side. The kneecap, that is known as the patella. And then the lower leg, you have 2 bones, the tibia and the fibula. The tibia is much thicker and larger. Allows, once again, for the weight transfer from the femur down. Most of the weight is going to be transferred through the tibia down to the foot. The fibula is much smaller because it's not having to carry the weight. It's for muscle attachment. In the foot, on the ankle, you're going to have 7 tarsal bones. The foot itself is metatarsals. There's 5 of them. And then in the toes, there are 14 phalanges. So you start to see some similarities between the foot and the hand in terms of the bones and how they're structured. So once again, this is showing with the femur, and once again, it's just going to take time on your part to sit down, learn the names of the bones, and I usually recommend learn the names of the bones first so that you know where they're located, and then learn the various markings on the bones. It doesn't do you any good to know the markings on the bone if you don't know where the femur is, as an example. So learn where the bone is, and then go back and learn the various major markings on them, such as, say, the neck here that's involved with the joint, the pelvic joint, or hip joint, As you can see, the neck of the femur is going to be in that joint much more securely, so it gives lots of stability, but it's going to be less flexible then. And over here you're seeing the patella or the kneecap. And then the tibia and the fibula, as I said, the tibia is much larger because it's transferring the weight. But you have with the fibula, if you're like, well, why is that even there then? It's for muscle attachment. And then when you look at the ankle and the foot, once again, the ankle, you have the tarsal bones, the metatarsals across right here, and then the phalanges for the toes. And once again, similar to the hand, your big toe is only going to have 2 bones. All the other toes will have 3 in terms of the phalanges. Once again, just practice learning metatarsals are numbered 1 through 5. In terms of the phalanges, the hallux is the name for the big toe. You just have the proximal phalange and the distal phalange. The other 4 remaining toes, you're going to have the proximal, middle, and distal phalanges. And then as far as the tarsal bones, you're going to have to, once again, just sit down and learn them. They're a little bit easier than the carpals of the wrist. The cuneiforms, you have a medial, intermediate, and lateral cuneiform, so you're using those directional terms in the naming of it. The navicular, the talus, the cuboid, and the calcaneus. The foot does have 3 different arches. There's an anterior transverse arch. Basically, that is the arch going from like the big toe over to your small toe in this direction. You have a lateral longitudinal arch, which is going from the small toe towards the heel, and the medial longitudinal arch is the arch that goes essentially from the direction on the side of your big toe back towards the heel. Normal foot arches, when you do your footprint, this is what it should look like. Someone, when you hear them talk about having being flat-footed, they don't have arches, and so if you look at the footprint, you would have the entire footprint instead of, because of the arches, you wouldn't have a footprint here on the normal. And then if somebody has a high arch, you just see the imprint along by the toes and then the heel.